Hello everyone, my name is Miriam Mutebi and I'm a breast cancer surgeon. I'm here today to talk to you a little about breast cancer and how you can collectively improve your breast health. If you think about cancer, we have to have an understanding of the body. Now, the body and our organs are made up of what we call cells. Now, cells are pretty much like every one of us. They're born, they get into teenagehood, they stress their parents, they become useful members of society, so they become older and are assigned to different tasks like, producing certain hormones or organs in the body. And then when they grow old, they're retired and die. Now, the only difference between a normal cell and a cancer cell is that the cancer cell has escaped the normal control mechanisms of the body. And so what that means is that these cells continue to grow uncontrollably. And once they continue to grow uncontrollably, they have the potential to spread to other areas of the body and cause problems in those areas. The diagnosis of breast cancer involves what we call typically a triple assessment. Patients may come in with signs and symptoms of breast concern and would typically have a clinical breast exam where they may pick up some pathology. Sometimes patients may not necessarily have any symptoms, and that's why it's important, because if you're going for regular screening, for instance having what we call a mammography, which is an x-ray of the breast, sometimes it may pick up lumps that you're not necessarily able to feel or areas of concern. Once these areas of concern have been delineated, or after the clinical breast exam where a health worker, a nurse or a doctor examines you and finds maybe a concern, you will typically be sent for some imaging. If you're above 40, you may have what we call a mammogram, which is an x-ray of the breast, or you may have an ultrasound. Once something worrisome has been demonstrated, then you will have what we call a biopsy, where we put a small needle in and take a small amount of tissue to the lab to confirm what the diagnosis is.